The topic that we are going to discuss today is liver. What is liver? It is the largest gland in the human body. This is how a liver looks like. Its location is such that it extends from 7th to 11th rib vertically, and in the regions of the abdomen it is such that it extends from the right hypochondrium till the left hypochondrium, crosses the epigastrium on the way. So this is how liver is placed in the abdomen. Liver has two surfaces. One is the diaphragmatic surface and one is the visceral surface. Diaphragmatic surface is the one which we can see on the surface, the anterior surface, the superior surface, and partly the posterior surface. And the visceral surface is the one that lies inferiorly, mainly, and posteriorly. Diaphragmatic surface is smooth and the visceral surface has various visceral impressions because this is the one that has all the organs that lie beneath the liver. And diaphragmatic surface is the one which is covered with diaphragm, anteriorly and superiorly, both. Now, if we talk about the ligaments of the liver, the liver is covered with visceral peritoneum. The visceral peritoneum is entirely almost covering the liver. It comes from the diaphragm and then it forms two parts. One is the anterior and one is the posterior part of the coronary ligament. So the superior surface of the liver has an extension of the visceral peritoneum that is called the coronary ligament. Now the coronary ligament goes on the left. The two parts join to form the left triangular ligament, and on the right it forms the right triangular ligament. On the anterior surface, the liver has a ligament that is called the falciform ligament. The falciform ligament basically connects liver with the anterior abdominal wall. Inferiorly, there is a small extension that is called the round ligament of the liver. So we have talked about the right triangular ligament here, the left triangular ligament here, the coronary ligament here, the falciform ligament on the anterior surface. So this is the diaphragmatic surface of the liver. Here we can see a small gallbladder that is basically on the posterior inferior surface, but we can see it peeping through the anterior surface. Now if we talk about the visceral surface of the liver, on the visceral surface we have the right sagittal fissure and the left sagittal fissure. In between we have the porta hepatis. Visceral surface has basically various impressions. Now this is the impression for stomach, the gastric impression. This is the impression for the colon, so the colic area, the gastric area. This area is the impression for suprarenal, so this is the suprarenal area. This one is the renal area. So the gastric area, the colic area, the suprarenal area, and the renal area. At this point we have inferior vena cava. And here we have the gallbladder, which we can see on the diaphragmatic surface as well. So this one is the gallbladder. Now the liver is divided into two lobes. One is anatomical lobes and one is the functional lobes. So first of all, we'll discuss the anatomical lobes. Anatomically, the liver has two lobes, the right lobe and the left lobe. The right lobe is larger than the left lobe. Functionally, we have four lobes. How? Here we can see this is the right lobe, this is the left lobe, this one is the caudate lobe, and this one is the quadrate lobe. So functionally, the liver is divided into four lobes, which are the right lobe, the left lobe, the caudate lobe posteriorly, and the quadrate lobe anteriorly. The caudate lobe is also called the third liver. It is sometimes called the third liver. Now, if we talk about this area, which is called the porta hepatis. So what is porta hepatis? Porta hepatis is the area where portal triad is present. And what is portal triad? Portal triad is the area where three things are present: the portal vein, the hepatic artery, and the bile duct. So portal triad is the area that is present at the level of porta hepatis, and it contains the three things: portal vein, hepatic artery, and the bile duct. Now we are going to discuss the segments of the liver. The liver has 8 segments. The diaphragmatic surface is divided into right and left halves by an imaginary line that is called the Cantley's line. Cantley's line divides it into right lobe and left lobe. And on the visceral surface, the area of the right sagittal fissure is the demarcating point, dividing into right and left lobes. Now, the right lobe is further, basically the Cantley's line is passing through the area of the main portal fissure, through which the middle hepatic veins pass, middle hepatic vein. Now, the right lobe is further subdivided into two, the medial one and the lateral one. And this is the right portal fissure through which the right hepatic vein passes, right hepatic vein. And the left lobe is further subdivided into medial and lateral parts by the left umbilical fissure through which the left hepatic vein passes. So basically what happens is that the main portal fissure is the one which gives way to the middle hepatic vein. The right lobe is further subdivided into a medial division and a lateral division by the right portal fissure through which the right hepatic vein passes, and the left lobe is further subdivided into a medial division and a lateral division through the left umbilical fissure through which the left hepatic vein passes. Next, what happens is that the liver is further subdivided transversely, the transverse portal fissure, like this, which divides it, all the lobes, the 4 lobes, but the left medial division. So left medial division remains as such. Rest are subdivided into 2. This one into 2, this one into 2, and this one also into 2. So the divisions of the segments of the liver are such that on the visceral surface we can see that this is the caudate lobe and this one is the quadrate lobe. So caudate lobe is the first segment of the liver, segment 1 of the liver. And then going clockwise, this is the segment 2 of the liver, segment 3 of the liver, this is segment 4, this entire one is the segment 4, this is segment 5, this is segment 6, this is segment 7, and this is segment 8. So this is how we divide liver into 8 segments which have surgical importance. Now each segment has their own portal vein, portal artery, and bile duct, hepatic duct. So the primary main portal fissure has the primary division of the portal triad, the secondary one has secondary division of the portal triad, and the tertiary one has the tertiary division of the portal triad. So this is how we divide the liver into 8 segments. I'll repeat this once again, that first is the main portal fissure, which is by an imaginary line called the Cantley's line, through which middle hepatic vein passes. Then the next one is the right portal fissure in the right lobe, which divides it into a lateral division and a medial division through which the right hepatic vein passes. Then the left lobe is divided through the left umbilical fissure through which the left hepatic vein passes, and it divides it into a medial division and a lateral division. Then a transverse portal fissure divides all these into two each except for the left medial division. This one is not divided. This is a single lobe. And then the caudate lobe seen on the visceral surface is the segment 1 of the liver, and then going clockwise, this is segment 2, segment 3, segment 4, segment 5, segment 6, segment 7, and segment 8. Now, anatomically, this segment 4 is part of the right lobe of the liver, but functionally, this is part of the left lobe of the liver. So, on the right side of the Cantley's line is the right lobe, and on the left of the Cantley's line is the left lobe. So, anatomically, segment 4 of the liver is included in the right lobe, but functionally it is part of the left lobe. So this fact is very important. So that's about today. Thank you.